My fellow commissioners are here, as well as Scott Forrester from our Emergency Management Director, as well, and Dr. Danciger from our Health Department. And I would like to introduce Dr. Danciger first to give you an update on where things are in Bucks County today.
Thank you, Commissioner. We just wanted to announce today we now have 14 confirmed cases of coronavirus in Bucks County. We received 2 just a few minutes ago, one of whom is our first child, but we have a lot more investigating to do and contact tracing on that case, so we'll have more information in upcoming releases on that. We are starting to see potentially our first indications of some community spread. We obviously know that Montgomery County has declared the community spread there, and so we know it's just a matter of time before we start to have it here. The last couple of cases before today, we were not able to determine a specific point of infection. We're still looking, but our initial indications are that we may not find any. So we do want to just make it clear that most importantly, if you don't need to be out and about, if you don't have an essential job, we want you to stay home, stay with your family, and that's the best advice we can give. If you do go out, make sure you're not sick. If you do interact with anyone else, make sure you're not sick. Make sure you're washing your hands, all the common sense things that we talk about on a regular basis. And Commissioner Harvey, or Scott?
Get Scott.
Scott Forrester, please.
Thank you, Doctor. I'm Scott Forrester. I'm the Director of Emergency Services for Bucks County. So our planning efforts and our preparedness efforts are in full swing. We've spent a lot of time working with municipalities, with all the county agencies and departments, as well as the hospitals and long-term care facilities. At this point, we have a lot of resources that we have purchased and ordered in the way of supplies for the protection of our public safety workers, for our healthcare workers, and for our public health workers. I can't tell you enough about how great the partnership and the coordination has been with all the county agencies, with the municipalities, and all of the folks that we've been working with. The leadership of the commissioners have been great and very supportive in our efforts to combat this pandemic. I just want to echo what David said, is that if people are sick, it's so important. Stay home. Don't go out. Don't interact with other people, because you're just causing the illness to spread even more. So it's very important to know that we're working diligently. We're all still in a good partnership. There are no significant concerns that I have in the way that we can't manage or handle the situation at this point. So what I'm saying is, there's no need to panic. Everything is being worked on that we could. We've been doing a lot of planning with the facilities and the hospitals in the way of ensuring that they have staffing plans, ensuring that they have the equipment and the supplies that are needed to protect their employees, and we've been working well on how we are going to handle an influx of patients, if need be, to those care facilities. So those plans are well underway, and those actions are well underway, and it's a good team effort by everyone. Thank you.
Dr. Danciger and Director Forrester will take some questions when we're done. I wanted to say now that we are encouraging people, again, if you're sick, to stay home. We actually encourage everyone to stay home. But as you stay home, the days can get a little difficult. If you want to go on the county portal, you will find over my right-hand shoulder, we have some resources for parents, how to talk to children about this. We also have a number there if you need to talk to somebody, if you're feeling emotionally stressed or you're struggling with a mental health issue or an addiction issue, we're there for you. I did want to say that the county is technically open, but we are asking residents to make an appointment before you come in. That way we are able to continue that social distancing. Next, I'd like to introduce Commissioner Bob Harvey, who would like to speak to you on some economic issues.
Thank you. I'm Bob Harvey, Vice Chair of the Bucks County Commissioners. This is obviously a very difficult time for the community, for the country. We know, and we've already been hearing statistics about the economic fallout already. We know that Washington DC and Harrisburg are looking at measures to ease that suffering moving forward. The county did have a conference call yesterday with the 5 agencies that deal with economic and workforce development to begin planning on ways that we can help people who are working here in Bucks County, who own businesses here in Bucks County, ways that we can assist them moving forward. Over my left shoulder you will see, in addition to the portal we have right now, which is for economic resources, that includes connections to the Workforce Development Board and CareerLink, which can help those who are looking for employment. Believe it or not, we are getting, or they are getting, some contacts from companies who are looking for employees. Supermarkets being one of them. They're having trouble filling some of the needs they have in terms of staffing. So you can go to that link to find ways if you're looking for a job. In addition, the Industrial Development Authority, Redevelopment Authority, Economic Development Corporation, Visit Bucks County, all these agencies can provide a little bit of assistance and help through their networks for especially small businesses that are looking for some assistance. As we probably know, certainly one of the industries hardest hit is the hospitality industry. There are about 28,000 jobs in Bucks County, only Bucks County, 28,000 jobs connected to hospitality. And so we know those are jobs that are going to be in some need of assistance. We are asking people to consider, obviously you can't go out to eat, but consider ordering when it's possible for you financially, ordering out from some restaurant in your borough or township. Those are most likely owned by your neighbors. This is where your friends work, where your family work. Consider helping them out. We are also, our Department of Consumer Protection is doing investigations in price gouging in different areas. So if you have concerns about retail stores doing price gouging or having price gouging situations, contact our Department of Consumer Protection. Those cases could be turned over to the Attorney General. Fines for those violations can run into the thousands of dollars for the people who are committing them. We're also working through federal and state agencies looking for low interest loans for businesses. That information is also available on the portal we have here behind you. And finally, just reminding people, as has already been said, about social distancing, about working together. Hopefully we're past the stage where people were hoarding. We had a wave of that. We're hoping that people now begin to settle in a little bit and resist that. We know that our country's faced difficult times in the past. And we know that the way we pull through them as a country and a community is by working together. And this is another one of those times where we need to work together. So I'll turn over to Mr. Girolamo for a few words.
Good afternoon, everyone. Good to be with you. I think everybody summed it up already. I mean, I think what we need to do, again, don't panic. I mean, just continue to do the common sense precautions that everybody has talked about from the very beginning. I have a 92-year-old mom who is in pretty good health. She does have some underlying medical conditions. Me and my sister take care of her, basically. She's in a home by herself. My sister lives right next door to her, which is really, really good. But she has not gone out of the house for the last 2 weeks. We are just telling her, for her own safety, Mom, stay in the house. We are limiting the number of people who are coming in, basically just very, very few people once in a while. So doing those types of common sense things, I think, makes all the difference in the world, especially among our vulnerable senior citizens. So continue to do all those precautions. Don't panic. Again, the stores that are necessary to be open are going to continue to be open, and that's our supermarkets, our gas stations, the bank. I mean, they're going to continue to stay open. So there's no need to go out and panic and take all your money out of the bank or buy 50 cases of toilet paper. It makes no sense in the world. Those stores are going to continue to be open. And again, just to say what everybody said, we got a great team here. We really do. I mean, everybody in the county, we got a great employees, we're all working together. The health and safety and welfare of the residents of Bucks County are our #1 concern, and we're working with the state in constant communication with the state and the federal government, and making sure we got all the update information and continue to keep the residents of Bucks County here safe. So, thank you very much.
We'll take any questions that you have. Any questions at all?
With the possible community spread case, can you tell us, it sounded like that was from the 2 newest cases, and if so, was it the child or the adult?
What was one certainly was from yesterday,
Okay.
where we did a full contact trace and interview for extensively, and we were not able to find any travel or contact with someone that was out of the country or was a contact to a case. There may have been one, but he wasn't aware. And we're not going to, community spread usually requires multiple cases, sometimes 4, 5, 6 according to the state. But I think that given what's going on in the neighboring county, as you know, coronavirus doesn't care about County Line Road. I would say that even though we've had a couple, I would say that we're definitely moving our way there. And I think anyone would be silly to think that it's not going to happen in Bucks County also.
What's the condition of the 2 newest patients? Can you...
They're both, neither of them in the hospital, they're both at home.
Are they related?
No.
Has anyone in the county recovered yet from COVID-19, or are they still all symptomatic?
No, actually, some of our earlier cases are actually off of isolation already. They're doing just fine.
We haven't heard it so much in Bucks yet, but we are hearing in some surrounding areas that particularly younger people are not always following the rules, the social distancing and what have you. Can you kind of give us an update? It sounds like you're happy with the way this county is handling it.
Yeah, I think it's a team effort. Everyone on the stage, all the employees in multiple departments are doing a great job. Our municipal emergency management, police, everyone is working together to keep the panic down, to plan for things. But yeah, I've been asked this question multiple times now. Can you have a small group play date? And I want to make sure that we're all following common sense precautions. I think you can do a lot of things for mental health, mental fitness. I think it's probably good to have your kids out of the house, take a walk, be out in the sunshine. To sit around watching CNN all day is probably not the best thing for anyone's mental health. And I think that if you do the proper precautions, if you're smart, you can have a very small group out and about doing some things. And I think that it's probably a good thing for our children to do that.
And you're pretty confident that the community is listening.
Yeah, I mean, I saw on TV, you see in spring break, whenever it was in Florida, there's thousands of people on the beach. I don't think that's a great idea. No, I really don't. But we're certainly making sure that if anyone asks us, if anyone asks our opinion, if anyone asks emergency management, they'll all give the same answer. Do not have any large gatherings over 10 people, less if possible. But I don't think anyone on this podium would say that kids shouldn't interact with each other in very small groups. Most importantly, no one can be sick in those play dates. If your kid is sick, as we've said multiple times, keep you, yourself, your family home until you're feeling much better. I think that's the most important thing that we can say in this entire press conference.
Do you anticipate sustained community spread within the next week?
I can't give you a day, but if we've already had 2 cases that we're not sure where it came from, you can argue that there are cases out there. Just so people know, now that testing will be increasing very soon, we're getting word that there's multiple commercial labs that are going to be up and running soon. We're going to see more cases. And there's definitely good things about that, because you're going to start to see more and more people that are positive that are not very symptomatic, that are resting at home. They may feel not so great, but they're at home. And I think the more cases we do, we'll be able to say, hey, look, the denominator of cases is greater than we think. It's not just the people in the hospital. It's not just the people that you hear about on TV. So increased testing is going to make people feel a lot better in the end. It may make people feel a little bit more nervous at first when we get 5 cases a day, 10 cases a day, but that's only because of an increased testing situation more than anything else.
And as the testing goes up, and the cases, as you said, are likely to go up, are you confident that you have what you need, the masks, the treatments? A lot of back and forth about whether or not the resources are getting to the people who need them.
Yeah, and you want to take that? I mean, I know we're working on it. I mean, and it's I don't think anyone in the country will say they have all the masks they're ever going to need, because I think that's not true. but I know that we're working with the Emergency Management Agency to get supplies that we need on an ongoing basis. Do you want to take that too?
Thanks. So the county has been able to purchase some, and we've acquired many. We've already handed out many masks to police and to emergency medical services. As resources come in, we'll continue to give them out to public safety, as well as our hospital staff and our long-term care staff. It's been easy to get some resources and harder to get others. But we've also made resource requests to the state to receive supplies and equipment from the Strategic National Stockpile that is managed by the federal government. So we have not received those yet, but I'm hoping that soon they will come. We have a great logistics plan to distribute it. That was one of the functions we've been working on today and yesterday, is that distribution plan of supplies and resources, and we've been distributing things regularly as they come in.
Dr. Danciger, I know the state DOH had said play dates aren't a great idea. I know you're saying if someone's not sick or symptomatic. What's kind of the two different messages coming across there? Can you maybe elaborate more?
Yeah, I don't think anyone has the exact right answer on that. I think if you go around the country, you'll probably find multiple ideas on that. I do believe, again, this is for mental fitness of children too. I think social isolation is not good for anyone long term. If this situation was a week, 2 weeks, I think you could manage to keep everyone home, but this may stretch out into weeks and months. And I believe that children need, in some way, shape, or form, and adults too. I think isolation is bad for anybody, and I think if you do it in a safe, practical way with small groups, even one-on-one, make sure the parents are paying attention to what the kids are doing, making sure the parents immediately, move kids away if they develop any kind of symptoms, they complain about something. I think it can be done, and I think this is my opinion that I think in the right way, I think it's good for the mental health of our children. Yes.
And the other thing is demographic information. I know the county's been reluctant to release that. A lot of people, there's been a lot of rumors of different municipalities. Has the county policy changed? Are you planning to?
Yeah, I think what we're going to do is, based on the fact that now that there's community spread, I think we're going to have a map of indication. We won't give out ages. We're not doing that at this point, but I think we can give out some general information about where the cases are. If we can put together a map with colors of the municipalities that have cases. As this spreads, I anticipate that every municipality will be colored in eventually. But we want to make sure that before we do this, that everyone's aware that anyone who lives in a municipality that's colored in now, doesn't mean they should panic. And if you live in a municipality that's not yet colored in, you shouldn't be celebrating that there's no cases in your municipality, because that's probably not true. So we'll do that on a map, so you can show with community spread how it slowly, will affect all municipalities. So as long as everyone looks at it with the understanding as to why we're doing it, I think it can be a successful tool.
Dr. Danciger, have you looked into the basic reproduction rate, the R0 for COVID-19? Is there anything you can speak to on that as far as how it's spreading in the state?
Well, it's very difficult. I think we'll have more information on that when we start testing people, but when you have minimum numbers of testing, I mean, the entire state has tested, 200 plus, whatever the number is in the state. It's very difficult to know anything. I think in the next 2 to 3 weeks, when we have commercial labs being brought on board and we have more data, I think we can talk about a lot more of that epi stuff.
And do you have any idea the percentage of people who may have contracted the virus and who are asymptomatic, or is that probably still that?
Well, what I can tell you is this: we definitely have. I've interviewed every case we've had, except for I did actually speak to the mother of the case today, but people that are symptomatic, even at the beginning, they still feel something. I want everyone to realize that the asymptomatic spread, I want to make sure and so far from our discovery, people do have mild symptoms. They may not feel like it may not be a cough, it may not be a sneeze, the first symptom they feel, but people are to some degree symptomatic, and we're still. For the cases, there's just not enough cases for us to make any conclusive statements about that. But we know for sure that people that are coughing and sneezing and fully symptomatic are definitely the ones spreading the majority of the cases, because that's how the virus. That's why you do cough and sneeze, because the virus does that to you in order to spread itself.
With takeout and curbside options for meals, if you can kind of explain as a doctor what the risk factor is, if there is one.
Well, we're still inspecting all restaurants in Bucks County the same as if they were dine-in. We have our staff going out as much as we can, because some of our staff is obviously helping with the response, but we're still making sure that all restaurants their kitchen safety is just as good or better than usual. You know, we can't require that every restaurant take everyone's temperature every 5 minutes or anything like that, but we do have some guidelines we've spoken to them about, making sure that no one working in that kitchen is sick, and we can enforce things like that. But the hygiene and making the food and the food preparation with the line staff is just as important today as it was with dine-in. And we're making sure that all restaurants, and we'll hold them accountable to make sure they're operating safely, just like they were prior to the declaration.
Just a curiosity in trying to find that balancing point between wanting people to maintain social distancing and recognizing that these are our neighbors that work in these places who have mortgages to pay and what have you, and still wanting to support the businesses. So how do you kind of find that balance? You want to do takeout restaurants because you want to support the businesses, and at the same time, you're concerned about how much distance you put between you and someone else.
I believe that if you follow social distancing the vast majority of the time, it's going to be effective. Now remember, we're not even going to see the effects of what we're doing now for another week or two. The cases that we got today, these people were infected prior to any of the social distancing that was done. So I think we have some time before we're going to be able to see the effects. And believe me, what we're doing, it's never been done before. You know, what we're doing is going to work to a large degree because people really are staying home and people are going out to do things, but it's still much different than the normal functioning in our society. So I think you're going to see a difference. Again, the cases that you're going to see today, tomorrow, that will have zero effect on what we've done since over the weekend. It's going to take a week or two. If those people are infected a week, 2 weeks from now, then we need to look at, you know, how those things are working. But you know, everything. I think life is about small risks. You know, if you're going to go out and go to McDonald's and go to the drive-through, I mean, people still have to eat. People still have to get outside. I think what we're doing, it is a balance. You know, I wouldn't recommend that anyone stay in their house for the next month and never leave. I don't think that's good for anybody.
Any other questions? Thank you.
Thank you.
I had an economic question, actually.
Okay.
As far as, well, we have a lot of service industry workers here, and as you mentioned, there's even a shortage at times. With the talks of, you know, federal dollars going out to every American, has there been any talk about, as far as you're aware of, at the state level, of maybe, you know, funneling state dollars to these area workers that are affected?
What we've heard so far is coming out of the governor's office is very early. We have heard there are going to be some small business loans made available to businesses that can't otherwise get loans and don't qualify for loans at banks. Relatively low interest, somewhere in the 3.75 range. That was something just came out yesterday from the governor's office, and so still trying to get a handle on how that's going to work. We're hoping to have a conference call next week with the members of the leadership of those 5 agencies here in Bucks that deal with economic and workforce issues, and our state legislators, as well as the Congressman Fitzpatrick's office for Bucks, to have everybody together. The conversation we had yesterday with the 5 leaders really went very well in terms of them bouncing ideas off each other about how they can help each other, and different ideas about different funds that come from different pots of money, state money, federal money. Bucks County does have some funds through a couple different you know, mechanisms. The issue, for example, with the community development block grant money is that there are very specific parameters on how that money can be used. And so what we would be asking for at some point would be for those parameters to be lessened by the state or by the federal government so that we could use them more widely. You know, there's some funding right now, for example, in the county that's used for specific kinds of tourism industries that, you know, like wineries or something like that. And there's some discussion about how strict those rules are, and taking a look at them to see if we could loosen those, or if they're loose enough so that we could use them for businesses in Bucks, small businesses in Bucks that might be suffering through the next couple weeks.
Is there, if I'm an employee working for a business that might not be following the rules, is there some place that you're directing them to? I think we've covered a lot about price gouging and things like that, but what about the employees that might be put in a tough situation?
Right, and we do have the same agency, Weights and Measures and Consumer Protection. They're actually taking those calls as well about businesses. And one of the other things we're actually probably going to ask our staff to do is to begin looking for restaurants that may not be following the takeout only policy, because we want to make sure that they get, you know, sort of cited for violating that. That rule obviously is much more strict by the governor, is easier for us to enforce. It's much more difficult for us to go after businesses who may not be essential in our eyes, but of course in their mind they're essential and they want their workers there. There's not a lot of teeth that we have to go after them, quite frankly. Tom?
Yeah, I was curious if you guys had numbers on how many people so far have been applied for unemployment in Bucks County.
Don't know.
Okay.
No, we don't know that.
Any other questions? Thank you very much. Thanks for being
Thank you.
here.